Hello everyone, I'm Dr. Nandan Marathe. I'm a consultant spine surgeon with Synapse Spine. At Synapse Spine, apart from the surgeons, we have a big team of medical as well as paramedical staff who work together in giving you the best results. Today we have a member of our team, Dr. Concesao, who is a physiotherapist and the director of PhysioFit Clinic in Vasai. We have been working together for the past several years and she has managed a lot of our conservative as well as surgically treated patients. So thank you Dr. Concesao for agreeing to be a part of this and sparing some valuable time to share your knowledge with our viewers.
Thank you Dr. Nandan for your kind introduction.
We have a lot of patients suffering from low back pain who are working and doing a desk job.
Right.
During COVID, we have seen the shift from workplaces to work from home. And along with the COVID pandemic, we have a pandemic of low back pain resulting from work from home cases.
Right.
So, any take on ergonomics? How can we prevent this low back pain which happens due to long hours of sitting?
Right. So work from home culture or anywhere, if you go to work also, people have long sitting hours from 10 to 12 hours, right?
Right.
So ergonomics is very important here. Good back support, your screen should be on your eye level, your hands should be rested. These are very basic. Your feet should be on a ground or floor. That is very important. Apart from there, you cannot be in a static posture for a long time. We don't recommend patients to sit for long hours. At least in an hour, you should be able to do some body movement, just some movements in sitting. Or if you could just take a walk and come, that's very important. Any sitting static movement will cause you pain.
Correct. We do have some office spaces which have standing desks in addition to sitting. Do you recommend that?
Yes. That is now coming up in many offices.
Right.
So you can switch. You can stand for a while and you can sit for a while. As you know, sitting puts the maximum pressure on your spine.
Right.
So standing is better than sitting, but not like, again, no static movement for a long time. So no long standing and no long sitting.
You should be changing your
switch.
positions.
You switch and you do some exercises, some postural movements. That is more than enough to avoid the back pain. A lot of young patients in their 20s and 30s are suffering from terrible back pain because of this.
Right. Many patients do complain, or rather they have an excuse that our work hours are long, we commute to work for a long time, and there is no time to spare for the exercises that you suggested. So is there a way out for a patient who's caught up like that and there is no time to spare? What would you suggest?
See, I think everybody has time to scroll on Instagram these days. So I think they can take out some time for themselves, even 10 minutes a day for some postural exercises, some movement, some mobility will help them. Also, always walk where you can, always take the stairs where you can. See, our bodies are not made to sit and just stand or just be in a static posture. You just have to keep moving and that will, solve. Not just, if you can't go to the gym, it's fine. Twice a week you go, that's also fine. But some form of exercise is important.
So some lifestyle modifications and simple changes can help. Correct. We have seen a lot of these viral videos where there are chiropractors doing some maneuvers and there are strange sounds that are coming out. Patients also seem to be relieved after the chiropractic adjustment. So in your physiotherapy practice, do you also indulge in these adjustments, or like how different is it from the manual releases that you do?
So chiropractic treatments are not part of the current medical science ideally. We don't focus on these treatments. We don't do these treatments. Physios do manual releases and some other treatments that are involved, but not these noises and the viral videos that we are seeing.
Right.
Okay. In fact, the evidence suggests that these adjustments, body adjustments that they do, are in fact harmful for a lot of patients.
I completely agree with your view because patients do ask, is there a role for massage in my back pain? So I'm okay with gentle massages which can help and act as a pain reliever. But these aggressive adjustments can be detrimental.
Yes.
There have been instances where we ourselves have treated epidural hematomas, that is a blood clot in your spine, that has occurred as a result of these adjustments. So I don't support the use of aggressive back cracking.
Adjustments.
Right.
Yeah, so gentle massages are still fine. but your main focus has to be in conservative treatment, has to be exercise. Nothing will take that focus away. If you don't exercise, you just do massages or you just do some modalities, it will not help you.
Right. I believe apart from the strength training, physios also focus a lot on gait training and maintaining your balance.
Yes.
So strength training will help achieve a good bone mass to prevent a fracture.
Yes.
And gait and balance training will ensure you don't fall in the first place.
Exactly. We teach many methods or we give them many ideas how they can cope up with their less balance or how they can improve their balance. And we also give them some devices or some aids, walking aids, so that instead of fall, some people are very hesitant, some old people are very hesitant to take the walking aid. They're like, no, we won't use. But then I suggest that if not outside, at least use it in the house or in the bathroom where the chances of fall are the highest.
Right. I always tell them function over cosmesis any day. So flats over heels, walking aids over a fall and osteoporotic fracture.
Yes, definitely.
Osteoporosis, as we know, is age-related weakening of the bones, and we lose our bone mass as we age. So as a physiotherapy doctor, what tips would you have if I want to maintain my bone mass as I grow older?
Exercise.
Right.
As a physiotherapist, I will always suggest exercise in any form, but strength training is the most important. So when you strengthen not just your muscles, but also in turn your bone mass increases. So it is very important, especially in your 30s, to increase your bone mass, because after your 30s you start losing your bone mass.
Right.
So it is very important that you start now, because if you start now and then in next 20 years it will help you.
So you mean to say, if I am touching 60 or 70, there are age-appropriate exercises that I can do, including strength training?
Yes. So for a 20-year-old or a 30-year-old, our exercises regime will be completely different than for a 70 or a 80 or a 60-year-old also. And also depends on if you have osteoporosis, if you don't have, if you have fracture or whatever the cases are. All the things that we do are individualized and for age-appropriate patients. So we can do strength training for them also and avoid future fractures or injuries.
In India, we do not have a lot of awareness about this phenomenon called prehab. So we are well aware about rehab.
Yes.
So can you throw light on prehab? How important is it?
So prehab is something that you do before the surgery, like some exercises, some things that you practice before the surgery, so that you can do them post-surgery when you are in pain. When you do it pre-surgery, when in the rehab, which is pre-surgery, the chances of your stiffness also reduces post-surgery.
So you mean to say the post-surgical recovery will be faster?
Be better.
Right.
And you are able to do those exercises better.
Correct.
Your certain exercises also train your muscles to recover better post-surgery. So prehab is widely used outside of India. It is just coming up in India.
So if I have a planned date for surgery, how soon should I be sending a patient to you for prehab? Like, is there an ideal duration that you would recommend?
At least 3 weeks before, so the patient can practice and there is some kind of movement and strength happening in the area where the surgery is there.
Right. So, Dr. Concesao, we have this debate about modalities and exercises. So, in your practice, what is your emphasis on? Do you focus more on modalities or is your emphasis on exercises and manual releases?
So my focus is on exercises and manual releases. Right. The current evidence will support exercises only.
Yeah.
The modalities that you mentioned can be helpful in pain management, but a lot of times it's also placebo.
Right.
So we do use modalities, but it has to be in adjunct with the exercise therapy and other manual therapy methods that you're using. Only modalities will not give you the results that you want in a patient.
Right.
All the main treatment is through the exercise therapy only.
Right. That's a common misconception that patients usually are well versed and they use these terms like traction, use of IFT or TENS. And we don't really discuss exercises, but in reality you mean to say that it's the reverse.
Yes.
Right.
It's a very old method of treatment where people used to focus a lot of modalities. That is why that mentality is still going ahead, that physiotherapy is more of ultrasound and traction and light therapy, but we have so much more evidences that exercises help in all of this, and this is just a placebo that you feel that okay, I'm feeling better now for a while, but in long run exercise will only treat the cause.
Right.